to start off by giving a bit of context as to what is it that we're dealing with, and some of it was alluded to earlier in the welcome and introductions given by both Doctors Buss and Berry, to look at why is it that we're doing what we're doing and how we're working with countries, the resources available, and the networks and opportunities. Next, please. So we know and we've heard about the increases in the frequency of hurricanes and extreme weather events, the droughts, the floods, the coastal floodings, heat stress, wildfires, and so on due to climate change. And we know that these have direct and indirect impacts on health and health systems. So we see resulting risks of drowning, injuries, water vector-borne diseases, foodborne diseases, reduced agricultural yield, leading to malnutrition, food scarcity, strain on water resources. And this leads to political conflicts and migration in some instances, and mental health and psychosocial challenges. Next slide, please. These impacts we know already here, and just in June 2023, we had floodings in Chile. Dr. Berry mentioned the wildfires in Canada in June, and we had in the US, we also suffered from the air quality issues related to that. And in Uruguay, drought in 2023, resulting in water scarcity. Next slide, please. Dr. Berry had also mentioned in his introductions the peoples that we serve and the issues related to inequities and inequalities. And as we know, climate change does not affect everyone equally. Some populations have a disproportionate burden, and incorporating equity means that our efforts have to be targeted towards these groups in vulnerable conditions. And so we need to have a proactive approach to climate resilience to ensure that no one is left behind. Next slide, please. And so in terms of our work, the World Health Organization in 2015 developed an operational framework for building climate resilient health systems, which has 10 building blocks. I won't go through all the blocks here, but I will refer to some of them in the work that PAHO is directly doing with countries. Next slide, please. So PAHO is working with 7 blocks, all focused on strengthening climate resilient health systems. And this also builds on the 10 WHO blocks. And the areas are related to governance and institutional structures, health infrastructure and services, health and climate service systems, health co-benefits, research and capacity building, health and climate financing. And I will speak a bit to each of these areas, the 7 blocks, and discuss or mention some of the tools and resources that we have and the partnerships that we work with under each of these areas. Next, please. So in terms of governance and institutional structures, we're working with countries to empower the health sector. We recognize that health is really late in the game where climate change is concerned. And so we're helping countries to put health on the climate change agenda. So in essence, pushing health in every sphere there is so that it's recognized as being important, and to help in terms of strengthening that nexus and the discussion between climate change and health, using the resources we have and the partnerships, building partnerships outside of health, also using a cross-sectoral approach, collaborating with environment, energy, urban planning, transportation, and others, and helping countries in terms of leading discussions to advocate for health-focused climate resilience in different areas. Next slide, please. With respect to health and climate change strategic planning, we know that strategic planning is essential for a coordinated and efficient response to the health impacts of climate change. And so through these plans, we help to foster collaboration between neighboring countries, allowing shared resources and knowledge. So in terms of these plans, we have certain documents that have been developed, such as the Caribbean Action Plan on Health and Climate Change, which was developed in 2019. And this was a collaboration between ministers of health and ministers of environment in the Caribbean. And here lies an opportunity for us, because this is a 5-year plan and this year is the last year of the plan. So it's an opportune time for us to look at developing a new plan for the Caribbean region from 2024 onward. We also have plans which are developed, the Andino Plan for Health and Climate Change, and we have declarations which have been made and strategic plans developed by ministers of health of Mercosur. These guidelines, some of the guidelines that we have developed also help in terms of realizing some of the strategic plans that countries have designed. Next slide, please. So just to show a few more of the guidance documents that we have, you will see one for health vulnerability and adaptation assessments, and that's one that's developed in collaboration with Health Canada. And this is where we work with countries to help to develop their health national adaptation plans, because we recognize that there's the importance for these plans. Some countries have their national adaptation plans for climate change, but the health component is missing. And this is where we're working with countries in terms of doing some of these vulnerability and adaptation assessments and helping to develop their plans, which in some instances are referred to as the HNAPs. So we also have documents and quality criteria for the health national adaptation plans to ensure that what we're doing is consistent across the board, and that there's some kind of synchrony and a standardization in terms of the outputs. This document, the guidance for including health in nationally determined contributions, a document developed by PAHO, and this helps countries in terms of when they're having their discussions related to their nationally determined contributions, and that has to do with reducing greenhouse gas emissions, that we help in terms of ensuring that health is included as part of that. And then, of course, there are some WHO guidelines on frameworks for building climate resilient health systems. Next, please. In terms of this area too, we do conduct surveys from PAHO and WHO with countries, and the important information that we gather from these surveys help us to realize where gaps are, where countries' priorities are in terms of climate change and health, and then to help to focus that in terms of developing proposals to attract resources to help to fill those gaps. These health and climate change country profiles, we have worked with countries to develop over the years, and we're actually in the process of working with some countries to do new plans and also to update the profiles in the next year. And these profiles give information on what exists in the country in terms of the health relevant climate risks. It gives information specific to countries in terms of their annual temperatures, the number of extreme hot days, precipitation, and so on, and then the impacts on health in terms of the extreme weather events, vector-borne diseases, and so on. So this presents historical data and also scenarios which could exist with respect to the countries. And this also forms part of their national policy documents and actions. We also are rolling out a survey, actually it's almost complete, for this year for countries in Latin America and the Caribbean. So I'll put a plug here for those who may not have completed the survey as yet to please do so. Next slide, please. So this just shows a bit more detail of some of what is included in a health and climate change country profile. This one is from Trinidad and Tobago, and it has some key recommendations there. And based on that, we can then help countries to develop their health national adaptation plans. Next slide, please. Next slide. Yes, so it's just giving details. Keep going, please. Right, thank you. So in terms of climate resilient infrastructure, I think many persons may have heard of smart health facilities, that is making the facilities safe, green, resilient. And so there are several health facilities that have been smarted, specifically in the Caribbean region through funding from the UK government. And one of the things that we know is that the health sector contributes to greenhouse gas emissions. We are also culpable where that is concerned. And so we have to ensure that we, in a sense, get our houses in order. And so we look at, we have tools that can be used to help the health sectors to assess the greenhouse gas emissions and then put measures in place to reduce such. And some of the tools have been developed with our partners from Healthcare Without Harm and others. The other thing we note is that in Latin America and the Caribbean, about 77% of our health facilities are located in areas at risk of climate disasters. And so the same health sectors which have to respond to the emergence or the increases of health impacts due to climate change themselves are also impacted by climate change. And so we also in I think in the session this morning will also have some presenters who will speak a bit more on using these tools in terms of our smarting our healthcare facilities and making them more resilient. Next, please. And these are some of the guidelines that would have been mentioned. There are guidelines produced on climate resilient and environmentally sustainable healthcare facilities. There's a SMART toolkit, which is used to assess the facilities, and indexes given, and then the decisions made as to how to improve those facilities and their checklists, and then also looking at the carbon footprint or greenhouse gas emissions. Next slide. In terms of health and climate surveillance systems, which is another pillar under which we work, and I'm happy to see that from participants, we have persons who have expertise in this area, so it really will enrich our discussions, is the importance to collect data, data from the climate sector, but also from the health sector. And what we realize is that the climate data is existing. The issues and challenges that we have tend to lie within the health sector. And so we're working with countries here to improve their surveillance systems, because when we have those surveillance systems improved with the data captured from the environmental sector, from the health sector, from the meteorological sector, then we're able to analyze that data and to be able to identify trends and patterns, and to also be able to forecast potential outbreaks based on the indicators, and to inform countries, communicate to persons, so that we can also put some preventive measures in place. So we're be better able to respond, not in a reactive way all the time, but being proactive. Next slide, please. So this is just showing the different types of data that we could use to analyze and to communicate to policymakers, specialists, and citizens, and the importance of communication. We'll hear a bit about that, more about that later, and then to develop these risk maps and early warning systems. Because as we're mentioning the populations of vulnerability, then we would know where these persons exist and what are the special measures that we would need to put in place to protect them. Next, please. And this slide is just showing that if we're looking, for example, at the risk of dengue, some of the parameters that we would be looking at have to do with temperature, humidity, precipitation, and so on, and how that impacts on the vector, and then being able to predict where this vector would be, the increase in numbers of vector at a certain time of year, and of course, then be able to put our measures in place to prevent outbreaks. Next, please. These are then some documents on early warning and alert response systems, quality criteria for evaluation of these systems, and multi-hazard early warning systems and checklists. So there's a wealth of resources that we do have and have developed also with partners to help in terms of building climate resilient health systems. Next, please. With respect to health co-benefits of climate change, and here we're looking at some mitigation measures. So there are several tools that have been developed that we are promoting their use in countries to look at what is the case that we can make. If we do nothing, what happens? How much does it cost us? What would be the benefit in terms of health, but not only in terms of health, but we can then put some economic or dollar value to it so that we can speak to different sectors. And so we're looking at, next slide, please. So we're looking at tools related to, for example, air quality, measuring air quality, measuring greenhouse gas emissions, and so on. And PAHO has this 120 Clean Cities Challenge. And basically it is countries that are interested can reach out to us, and we can work with the countries to use these tools in a particular city or some cities to do the measurements that that we need to have that evidence, that data, and that's always important, the evidence, so that we can make the case. And Colombia is a good example in that Colombia has used one of the tools. Next slide, please. One of the tools for determining the contributions in their NDCs. And what they have found from using this particular tool is that 25,600 deaths could be averted between the period of 2021 to 2030, and 3,800 deaths per year from 2030 onwards. And that is the possibility of the avoidance of 2,750 cases of hospitalization per year from respiratory and cardiovascular causes from 2030 onwards, a reduction of 892,000 episodes of asthma per year in children from 2030 onwards. So these are projections that they were able to do based on these tools. But very important for some sectors, and this is a sector that handles the monies that we're trying to access in order to help the countries. In terms of the economic benefits, up to $12.9 billion US could be saved between 2021 and 2030, and $1.8 billion per year from 2030 onwards. And that speaks volumes, I think. Next slide, please. So these are just mentioning some of the tools. There's the ClimateQH, which has to do with the reduction of the carbon footprint. The AirQ Plus is related to air quality assessment in relation to morbidity and mortality. And then the tool that's called HEAT, which is not anything to do with being hot, but is health economic assessment tool for walking and cycling. So it's looking at if we walk and we cycle versus driving, what does it mean for our health and so on. So these tools help us to gather the evidence. Next slide, please. Capacity building is a second to last pillar. Capacity building. So we do quite a bit of capacity building in terms of training of persons in the health sector, health professionals, and so on. We also do youth engagement as a next generation. So, you know, it's interesting that in the question earlier that was asked, you know, if we want to go to the future or go back to the past, and somebody saying, you know, being afraid of the future, because what we're seeing now, if we don't do anything quickly, or if we don't do some things quickly, then the future doesn't look too bright from some angles. And so we're looking to also engage the young people and listen and hear from them in different dialogues that we'll have, because we're looking to foster a cadre of young people. Next slide, please. And so this just shows some of the training programs that we've had in collaboration with partners, with IAI, with the Global Consortium on Climate and Health Education. And we also have courses on PAHO's virtual campus. Next, please. Thank you. And then there is a course that's actually going on now on El Nino, and we have had courses on for health responders, and we've had a course specific for the Andean region. Next, please. And here this speaks to a training that we've had, that we continue to do actually with the University of the West Indies, and this is a climate change and health leaders course. And there's a cohort each year with six persons. It's a really competitive process, and this is funded by a project that's with the European Union. But any country in the Caribbean, young people are encouraged to apply, and that information can be provided. There's one more cohort, I believe, that will the registration will start next month. Next, please. And the final pillar, financing of health and climate programs. And so it's less than 0.5% of global climate financing has been allocated for health projects. And so we have been working with countries to develop their proposals or project portfolio of project proposals for submission to the Green Climate Fund and other partners. And we have been working with others on behalf of countries. Next slide. And there's some projects that we have going on now funded by the European Union in the Caribbean. We also have a Green Climate Fund project in the Caribbean also, and one in Argentina. Next slide. And we have been having training courses with countries to help them to develop proposals for submission for funding for climate change and health. Next, please. I will just mention here, as Dr. Buss spoke to it earlier, more information can be found on the site on the Alliance for Transformation, Action and Climate Change and Health. That's the ATTACH or the Alliance. Next slide, please. Next slide, please. The next slide, please. And just to finish off, because I'm conscious of the time, just to finish off by saying Dr. Buss had mentioned these opportunities that are coming up next week and later on in the year. And so I will just end there and hopefully we'll have some time for interactions. Thank you very much.
That she and you have made so clearly is that communication is done best when you have a real understanding of your target audience and what they're trying to accomplish. And in the 15 or 20 or 25 minutes we have together this morning, I don't really have time to go into all of those different target audiences and asks that we are making of people or suggestions that we are making to them. So instead, I'm going to give the 60,000 foot view, okay? We, all of us in this conversation today, all of us have a special place in our society. We are health professionals, and as health professionals, we are unusually highly trusted sources of information about a whole range of issues. And it's very clear that among those issues includes climate change, including the human health relevance of climate change. So the way I want to frame my comments today is suggesting to you a way that you can think about using your trusted voice in your community, not both your professional community as well as the geographic community in which you live and work, to help that community better understand the climate impacts that it's facing, the health impacts that it's facing, both citizens as well as the health system, and opportunities that we individually and collectively can take to respond to those risks. The first thing that you have to understand, went too far forward, is that when you speak to people about climate change, you are speaking to them on top of their pre-existing understanding of how they think about the issue, okay? Really important to understand. They are not blank slates. They are everything you say, everything you share will be interpreted by them through the lens of how they are already thinking about the issue. My colleague, Tony Leiserowitz at Yale, and I have been surveying people here in the United States, about 2,500 a year since 2008. We conduct these surveys twice a year. And before we ask people, our survey respondents, any other question about global warming, we ask this question: what's the first thing that comes to mind when you hear global warming? And the reason we ask this question is because we believe it's the single most important thing we need to understand about them because it puts in context everything else, all of the other questions that we will ask, and everything else they tell us about how they think about the issue, feel about the issue, and what, if anything, they personally are doing, and what they would like to see we as a community or a society do. And it is as true today as when we started this surveying in 2008, that for most people in the United States, and I would contend this is likely true of most people in Canada, perhaps less true for people in Mexico and south of us in the Americas, but for most North Americans, the first thing that comes to mind is essentially a polar bear. References. People are answering our question in their own words, but then we code those words, and references to animals, creatures, other living things in the environment is the top of mind association. It's easy to understand why that would be the case, because so often on media reports about climate change or global warming, we see pictures of polar bears, perhaps not as happy as this fellow. This fellow looks quite happy. Usually it's a picture of a bedraggled polar bear, perhaps on a very small piece of ice, looking like the end is near. The second most common response we get to that question, what's the first thing that comes to mind, tends to be associations with science. So this happens to be the Keeling curve, representation of the atmospheric CO2 levels on top of the mountain in Hawaii. And this is, in fact, something we hear often, sometimes even by name, the Keeling curve. But generally, the second most common reference we get are references to science, which, a bit like polar bears, are interesting, understandable, but not necessarily personally relevant to most people. The next most common response that we get, sorry, I'm having a hard time controlling these slides, is references to politicians, people who are sort of notable officials in the public dialogue, either current or past politicians who've been vocal on the issue. The important thing to understand about this is that those references are almost always to political voices or political actors who are in the other camp, who are in the other political party. So from people here in the United States, we see a lot of references to Al Gore, Barack Obama, Nancy Pelosi, and almost all of those references are made by people in the Republican Party, people who think of these leaders as wrong-headed leaders who are taking our nation in the wrong direction. So again, like references to plants, penguins, or polar bears, like references to science, references to politicians, political actors from the other tribe are not necessarily helpful ways for people to be thinking about the issue. It suggests that the people who give these answers are thinking that this issue is not personally relevant to them and their tribe. It's relevant to others who have the wrong idea. Over time, across this 15 years that we've been conducting these surveys, we have seen increasingly frequent references to weather, to extreme weather, harmful weather. And we think this is a step in the right direction. Here in the United States, I work very closely with the broadcast meteorology community, people who report what tomorrow's weather will be through the local television news. There has been a 100-fold increase in the rate of this reporting over the past 10 years here in the United States. And we're seeing it very clearly in people's top-of-mind associations. The fact that 15 years ago, very few people talked about extreme weather as their top-of-mind understanding, and now an increasing number of people do so. But I would contend that your and my opportunity is to help people think about climate change in a new way that is that will help clarify to them exactly the most important way that climate change is relevant to their lives, because it's relevant to our health, the health of our children, the health of other family members, the health of our community members. Our research shows very clearly that people who do understand that climate change is relevant to our health, and we haven't done this research, but I'd suggest it's a fairly good bet that people who understand that climate change threatens the readiness, the resilience of our healthcare facilities that we all count on will also be more likely to support the of actions that we as a community can take to help ensure climate resilient health facilities. My specialty in public health is as a public health communication expert. This is work I've been doing for over 4 decades now, for the past 15 years exclusively on the issue of climate change as a health issue. But what I've learned in those 4 decades is that when we succeed in sharing information that we know to be true about human health and well-being, when we have simple, clear messages that are repeated often by a variety of trusted and caring voices. This is the formula, the evidence-based formula for effective public health communication campaigns. And this is directly relevant to the opportunity we all have right now to help develop climate resilient health systems in our countries. What we've learned from our research is that essentially there are only 6 key beliefs, 6 key truths is what I like to call them, or 6 key facts about global warming that differentiate people in my country, at least, who are much more engaged in supporting climate solutions, both in their own lives and collectively through smarter public policy in their community, in their state, and in our nation. And those six key facts are that climate change is real, that it's us, it's human caused, that the experts agree. So regardless of what you might have heard in through media outlets or in social media, there really is widespread agreement among climate scientists that human-caused global warming is real, that it's bad, that it has a variety of impacts that go well beyond plants, penguins, and polar bears. It's bad for our health. It's bad for the readiness of our healthcare facilities. And then the fifth key fact is that there's hope. There are actions that we can take that will make a big difference. And then finally is the notion that if you are concerned about climate change, you are in the majority. The reason why this is such an important key fact is because most people do care. Most people are worried about climate change, but they feel they are in a very small minority. And by virtue of feeling they're in the small minority, they tend to be silent on the issue. But those people who are concerned about climate change and understand that the majority of people in their community, in their nation, are also concerned about climate change, they tend to be much more vocal in expressing their support for climate solutions. So I want you to think about these six key facts about global warming as six simple, clear messages that you can convey. The messages that I would suggest you focus on mostly are it's bad. Explain the ways in which climate change is eroding the healthcare readiness in your community, and explain that there's hope. There are lots of actions that we can take that will make a profound difference. On the issue of why is it we have to have our messages repeated often, I don't have a lot of time to go into this data, but this is data from a friend of mine, John Marshall at Potential Energy. He has been testing the impact of Facebook ads online, and what his research has shown is up to 80 message exposures per month. With each and every message exposure, people become more likely to take action. In other words, 2.5 messages per day is he's suggesting the optimal number of message repetitions is at least 2.5 times per day. He actually hasn't found the top end because the most messages he's ever tested is 80 times per month, or about 2.5 times per day. So we can't just assume that because we've said it once, people will understand and incorporate it into how they think. We need to create opportunities to convey our messages, the explanations of how climate change is harmful to health and to the readiness of our health system, and the profound opportunities we have to take actions that will make a difference. And then finally, I want to come back to just show you the data that I led with. The fact that in countries around the world, health professionals are the most trusted category of professionals. We are number one most trusted, and that creates special opportunities for us to share what we know about the impacts of climate change on our health and on the readiness of our health facilities. So all of you know by now that climate change harms health through at least 8 distinct pathways. Of those pathways, the one that has the most direct relevance, all of these pathways bring people into our healthcare system with greater frequencies, but one of those pathways, extreme weather events, actually erodes the readiness of our healthcare facilities to deal with that increased number of patients, people who need our help as health professionals. We've conducted a lot of communication research to identify simple, clear messages that will help people understand the human health relevance of climate change, and will build their support for us, health professionals, to take action in responding to climate change. I won't go into detail about that. The slides actually do provide references to where you can read the studies. I'll simply say that when we make the effort to teach people about these 8 pathways by which climate change harms health, And when we elucidate which people in communities are most likely to have their health harmed by these health impacts of climate change, what we find is that it dramatically increases both their cognitive and affective engagement with the issue. In other words, it makes them think this is a more personally relevant issue and become more concerned about the issue. And it's especially effective with people who are in the middle of the political continuum, people who I like to think of as swing voters, if you will, people who, if we can win them over, will help build a community consensus that we need to collectively take action to protect our health and to protect our healthcare facilities. There are essentially five different policy pathway solutions that we can take to protect our health. Two of those, numbers 4 and 5 on this slide, have everything to do with the readiness of our healthcare facilities. So when we talk about, when we explain to people the types of policy and programmatic actions that we can take, the use of clean renewable energy, climate smart foods, farms and food systems, clean and active transportation systems, improving our buildings and home, and including our community environments, people become more likely to support the very policies we need to put in place to take climate smart action. And the beauty of talking about climate change as a health issue is it puts the focus on what we can do in our community. And if we take those actions, our health benefits almost immediately, and we in our community are the primary beneficiaries of taking those actions. So just to wrap up, we've found that the most effective climate and health messages do three things. They elucidate the primary ways in which climate change harms health. They point to the primary policy solutions that we can take that will protect our health and protect the readiness of our healthcare system. And they affirm that a majority of people in our community, in our country, are concerned about climate change and support climate action. This messaging triad, if you will, is effective with people across the political continuum, but it's especially effective with political conservatives, a very important group for us to speak effectively with. So I think I've used my time, so I'm going to go to my last slide and say that the Global Climate and Health Alliance is a group you've been introduced to already. If you would like to work with them as a champion for climate and health in your country and on the global stage, I'd encourage you to go to their website. This QR code will take you there, and it will allow you to give them your name and email address, and they will alert you to opportunities to use your trusted voice to advocate for stronger climate and health policies. So with that, Amanda, I turn it back to you.
Based on the work of the non-governmental organization Health Hospitals Project, which we call PHS in Portuguese. Let me see. Okay. So PHS's mission is to transform healthcare sector into an example for society in terms of protecting the environment and the health of workers, patients, and the population in general. PHS co-coordinated the activities of the Global Green and Health Hospitals Network in Brazil, including the participation of Brazilian Healthcare Organization in the global campaigns, Healthcare Climate Challenge, and the Race to Zero, which is promoted by UNFCCC. And let's see here. Okay, oops. Yes, it's a problem here. Okay. So PHS emerged in 2005, 2008 from a meeting between some Brazilian healthcare professionals involved in environmental issues. And some colleagues from Healthcare Without Harm. So from this meeting, we started this work. And when I think about this meeting, today, I reflect about the importance of opportunities to get together and networking like this moment we are living now. And currently, PHS is a mix of think tank, advocacy movement, and community of practice that bring together practitioners, managers, researchers, and leaders from the healthcare sector to compose an extensive network of relationship with other health and environmental NGOs. Oops. Yes. So the Global Green and Health Hospitals Network was launched in 2011, and today has almost 2,000 organizations representing thousands of healthcare facilities in 81 countries. The global network offers a helpful opportunity for capacity building, identify priorities, and developing shared solutions. These interactions may involve hospitals thousands of kilometers away, but which often face very similar problems. So it's interesting to how rich South-to-South collaboration can be to promote sustainable innovation, and how the experience of colleagues in countries like India, South Africa, and Philippines have contributed to our work in Brazil and in Latin America. Because the way PHS come about, formed by health professionals and have as partners the organizations of occupational health, infection control, hospital management, and engineering, we have grown organically within Brazilian complex of healthcare organizations. 2023 is shaping up to be a year of more growth in PHS membership, and we hope to reach more than 400 facilities by the end of the year, this year, engaged in any of our 4 campaigns. Considering that Brazil is a nuanced and diverse country, we are very proud to have members in all Brazilian regions in a similar proportion to the distribution of the population. Our network is composed by public organizations from all levels, federal, state, and municipal governments, as well as private organizations, for-profit and not-for-profit, which reflects the composition of the national health system. This is the Global Green Network, Global Green and Health Hospitals Agenda, the founding document of our global network. The 10 objectives proposed in this document are still current now, and it's interesting to note how they dialogue very well with the 2030 agenda and the main issues on climate action and resilience. And in this slide, we see an overview of our 4 campaigns. We call it challenges that organize our work in Brazil: climate, waste, energy, and procurement. And as you can see, it's easy to talk after Karen and Edward, because they said almost everything about the resilience, the adaptation, and communication. And this work I'm showing now is more about how to build low carbon healthcare. So it's a part of our work. And for each challenge, you see here, we support the members of on 4 integrated approaches, which are in the figures with green backgrounds. And below this, examples of tools, guides, and events and dashboards created by PHS, the Global Green and Health Hospitals Network, and other partners. The first approach, and you see on the left, is the self-assessment, management, and control tools, which are customized for healthcare organizations. We offer individualized support from PHS team for each member, and with this assistance, even quite simple facilities are able to gather data, reports, and complete the challenge, identifying opportunities for improvement and measuring their progress. The second approach is national and global awards, case studies, and reports that give visibility, encourage, and reward the efforts of directors, leaders, and all the environmental and health professionals team who carry out the work. In addition to promote engagement, this is also an important way to collect successful experience and systematize knowledge collectively produced. The third approach is virtual communities, technical support, workshops, and seminars. The virtual groups and workshops reinforce ties, consolidate the sense of being part of a community of practice with mutual support and common goals. That's one of the most rewarding activities. The fourth, performance indicator dashboards and benchmark, is part of a data intelligence system that is being progressively improved. Collecting a large amount of data makes it possible to track the performance of each organization, as well as establish general conditions and identify trends by sector or region. This information provides evidence to support managers' decisions. The four approaches make work easier and repay members' efforts. This entire process is offered completely free of charge and has made it possible to improve environmental performance and resilience, especially in public organizations. Yes. Here we see the evolution of the participation of Brazilian health organizations in the four challenges. The Waste Challenge is certainly the most popular and should exceed 300 participants this year. The climate and energy challenges are quite difficult, but they are also increasing interest because they offer very accurate and useful information, including opportunities for cost reduction. The graphics only show the number of facilities that completed the challenge each annual cycle. Unfortunately, about a quarter of those who start are unable to complete the challenges. The procurement challenge is mainly aimed at health network and systems. Although they are fewer participants, each one manages several units and purchase together. So each member here represents a lot of facilities. Okay. This slide shows some of the documents produced by PHS to guide participants step by step on climate challenge, from gathering information to sending data. The climate challenge have forms to report leadership, resilience, actions, and a spreadsheet to calculate GHG emissions at the healthcare facility. We also have fields to inform the baseline and commitment to emissions reductions targets for 2030 and 2050. The challenge offers guidance documents for specific interventions, such as reducing emission from anesthetic gases, as you can see, and other from more general planning, like the roadmap for healthcare decarbonization, which the Portuguese version you can see in the lower right corner, and how to create an action plan, still only in English or Spanish, in the lower left corner. The Brazilian GHG Protocol Program is an important ally, providing free GHG emissions calculator, update annually, which results in highly accurate and standardized inventories undertaken by all types of organizations in Brazil. Other countries use the Climate Impact Checkup tool, a calculator provided by Healthcare Without Harm, to do the same, but at worldwide level. It's important to highlight that all participants in our challenge also provide an annual profile with data on their infrastructure and production, so that data on GHG emissions are as well as energy, waste, and procurement challenge will form indicators that have as denominators the number of patients attended, number of employees, square meters of construction, and etc. This allows us to monitor the evolution of emissions, opportunities for intervention, and the impact of reduction and resilience measures, as well as comparing results between similar facilities in the same region or same category. Okay, so now I will present just a few examples in other challenges. This is the sustainable procurement. And we should remember that more than 70% of healthcare emissions are scope 3. So supply management is key to the resilience of health system in terms of safety, reliability, and transition to low carbon healthcare. The sustainability procurement challenge integrate multiple product-related agendas, such as chemicals and toxics, clean energy, and efficient of equipment, less plastic, healthcare waste, and circular economy. Thanks to UNDP, who made possible this project, we were able to develop several supporting documents in 3 areas: governance, products, and suppliers. For an overview, I recommended the Sustainable Procurement Guide. And for those who read Portuguese, I suggest the self-assessment tool on governance and sustainable procurement, which is the core of our sustainable procurement challenge in Brazil. And this is another example that illustrated the potential of innovation developed by hospital in collaboration with suppliers. You can see more in PHS website. The highlight of the energy challenge is an overview of the institutional total energy consumption. So it includes including all forms of energy, electricity, fuels, self-generation, allowing to evaluate the efficiency of the operation and the rate of clean and renewable energy and opportunities for improvement. So using this challenge, you can calculate the whole amount of energy used and how clean is this energy. Trying to change here. Okay. This is another tool that we offer. It's a biodigester simulator. So you can calculate the reduction of GHG emissions from the methane of organic waste and how much energy is possible to generate with this waste. It's also very popular among Brazilian members. And still energy challenge. We see here some case studies. This is about efficiency gains of LED technology. And in this case, we evaluate the influence of the quality of the lamps. This means demonstrating why we need to avoid low quality LED lamps that are offered mainly to public hospitals. And in this slide is the this is another example of the energy challenge. This is the hospital where we are evaluating the quality of and the durability of the lamps. And the other one installed photovoltaic production of energy. This is the Waste Challenge. One of the most important products of the Waste Challenge is the online tool to help managers to track performance using an accurate set of indicators based on weighting the waste generated by categories and the methods of disposal. I'm almost finishing, yes. And here we see the plastic audit methodology developed by PHS using a combination of work from partners in Europe and Asia. This tool, already implemented in 3 Brazilian hospitals, is helping to reduce plastic consumption and waste generation, demonstrating that the health sector can and should contribute to the global treat on plastic pollution, an important issue. So I just want to thank to the PHS team and recognize their work and make ourselves available to share experience and contacts. And that's it. Thank you so much for having me today.
Thank you.
So, as you said, we will talk about smart hospitals tools and practice. Next slide.
Judith, I'm just going to pause you there just for a moment. This is Amanda.
The slide.
I'm having trouble hearing you. I don't know if anybody else is as well. It's almost like there's a little static. You can keep going. We'll try again. Just keep trying.
I apologize. I'm not sure what.
Oh, someone was suggesting
Okay.
maybe if you turn off your video to save bandwidth,
So,
you could try that for a moment. Yeah. Thanks for the suggestion, Lisa.
okay, let's see if that works better.
Oh,
Does
that's
it?
a lot clearer. Thank you, Lisa. High five to you over there.
Yeah,
Excellent suggestion.
Oh,
Thank
great.
you. Go ahead.
Thanks so much. Yes. Okay. So this is the SMART formula, and it is the SMART concept in practice, which is safe, green, and well-maintained health facilities, which are smart hospitals. Safe facilities are resilient, so they strengthen the process is to strengthen both the building and the infrastructure, but also to improve the operational aspects of how the facilities run to minimize downtime. And the greening process is to use the environmentally technologies that are available and relevant to the situation to minimize the carbon footprint, the consumption of energy and the consumption of water in particular, the generation of waste, and to promote recycling. Now, the losses, the gains due to making a facility safe and green would be lost without proper maintenance. So to make the gains sustainable, one must plan and execute preventive maintenance, and not only preventive maintenance, but to have a reserve of emergency maintenance and repair activity available for emergency situations. And a smart hospital can therefore both improve the provision of healthcare services and reduce the operational cost under normal conditions, as well as under emergency conditions, reduce the rebuilding cost after a disaster. On the next slide, what we show is an example of a classic smart hospital. This is Chateau Bel-Air Hospital in St. Vincent, and it is safe and green with a concrete roof, with shutters over the windows, and with reserves of water with solar power and solar hot water. And this facility withstood a volcanic eruption. It's not only just prepared for hurricane. On the next slide, we can see that the tools that help to create such a facility include the Hospital Safety Index, which is graded A to C, with an A scoring facility being one that can resist a hazard event of the level expected in the area and continue to operate and provide services to patients. The green checklist is scored as a percentage, with 70% being the gold standard and allowing the facility to have taken advantage of the opportunities for generating both savings and reducing carbon to a great extent. There's always room for further improvement, and there are further developments in technology, but that score shows that achievement. And there are additional technical guidance documents on the PAHO website. The website address will be given both in the chat and at the end of this presentation. And these documents include a preventive maintenance manual to guide facilities and guide government and organizations through setting up systems for anticipating and carrying out necessary maintenance on their assets. And there is a prescriptive guide to construction of Category 5 resistant roofs for hurricanes, in particular, as well as a model policy and case studies to assist health decision makers. And the photos are illustrations from these tools. On the next slide, we can see where PAHO has implemented the SMART concept in 7 countries over 7 years. The 7 countries being Belize, Guyana, Jamaica, Grenada, St. Vincent and the Grenadines, Dominica, and St. Lucia. And the various types of health facilities show the inclusiveness of the project, with a facility for the mentally challenged, the Palm View Center in Belize, elderly homes or homes for senior citizens in both Grenada and St. Lucia, the St. Lucia one being depicted here. And the medical stores building in Grenada was also retrofitted. Unfortunately, in Dominica, it was not retrofitted, and this is the result of Hurricane Maria's impact on the medical stores of Dominica, where you can imagine the stores inside, essential to the provision of healthcare, were severely compromised. So it's important to be very inclusive in the range of facilities and not only consider smart hospitals to be hospitals or health centers. On the next slide, the illustration gives the project's achievements. Output 1 being assessments and training and referring back to the Hospital Safety Index, the green checklist, and those tools on the website, which could be used to develop scope of works for retrofitting being output 2. Over 400 health facilities having been assessed, of which 55 facilities were actually retrofitted by the end of 2022, 110% of the original target, with, in addition, designs according to the SMART concept having been handed over to the Ministries of Health in 6 cases. And the importance of the focus on maintenance of those facilities that have been retrofitted and putting in place contingency plans so there is that readiness for the impact of climate change, as was captured earlier today when people had to identify keywords. And the stage we are in now is of advocacy, expanding the SMART concept beyond the initial countries, beyond the health sector, and the original communities where it was implemented. So on the next slide, there is an illustration of the current activities that are taking place. And these current activities include consolidating the gains with the national partners and those who are already familiar with the SMART concept. It was implemented by PAHO in collaboration with the local ministries of health, although funded by the UK government. And adaptation planning, risk assessment with the STAR tool, and updating of the contingency plans are examples of how we consolidate those gains in sectors and with partners who have already been exposed to the SMART concept. But the application of the SMART concept has now spread to other countries and other sectors, as hinted earlier, and with projects by other donors. So that this is another current activity, making the concept application more widely spread. And so the new facilities are being built according to the SMART concept, and the lessons learned are being spread even to the private sector. On the next slide, new tools are being shown, including the importance of vulnerability assessment that must be cost effective, so that we have a tool for calculating the return on investment of the proposed scope of works for smarting a facility as developed by Florida International University, and an app which is being developed by PAHO for creating a database capturing the assessments done and allowing input of new assessments with time. On the next slide, there is best practice for implementation. And one example shown here is the generator housing. A generator in the open air is well ventilated, but exposed to the elements and corrosion, as in the center photo. And a generator that is well protected from the elements, as on the right, is actually subject to overheating because it is not sufficiently well ventilated, having all these strong walls and strong roof overhead. So a balance must be achieved, and best practice involves that research into what is most practicable in the Caribbean situation. Check consultants identify problems like this, and with a wealth of experience, possible solutions. And the multi-hazard approach means that we mustn't only think hurricanes, there are volcanoes too. On the next slide, we have an infographic which captures the numbers of people trained in St. Lucia. A greater than 50% of women were trained. Not only that, the inclusivity provided by having ramps for the disabled constructed, purpose-built in spite of terrain at facilities as needed, such as Bexar, and the range of facilities and around the island. So the facilities are not only different types, but the locations are spread to cover the entire population on the little map shown there. On the next slide, we have further examples of the training, which was so inclusive. We have health professionals putting out fires and preparing for emergencies through generator training, and keeping facilities running smoothly through maintenance training. On the next slide, this inclusive training is put in practice to reduce the negative effects, not only during emergencies and disasters, but to be prepared for those events, but on a daily basis. And the emergencies shown here include that volcanic eruption that I mentioned earlier, and this is Chateau Belair under ash, as opposed to the picture shown earlier. And the Paramakatoy Health Center in Guyana, which is in a remote location, very difficult to access, where the SMART project was implemented by the Guyana Defense Force. And so on the next slide, we summarize that the Smart Hospitals project captures safety, greening and sustainability, inclusiveness, adaptability, and flexibility. This is hospital resilience. And a particular example on the next slide was given of a sneeze guard. The sneeze guard providing safety not only because it is behind burglar bars, but also from COVID-19 infection, and sustainability by providing that barrier to the escape of the air-conditioned air within the pharmacy to the outside, which was previously the case. So a simple example capturing those important principles. And I want to thank you for your attention and interest in the work of the Smart Hospitals project, and to refer you to the websites, both in the chat and at the end here on this slide.
So my name is Rebecca Schnitter, and I wanted to acknowledge with deep gratitude and respect that I'm calling in today from the land of the Lekwungen peoples, known today as the Esquimalt and Songhees nations. Very grateful to live, work, and play on these lands, which are commonly known as Victoria, BC. Next slide, please. So I'd like to share my positionality in relation to the discussion today. I'm a cisgender white woman and uninvited settler, and this social location impacts how I engage with this topic, and I recognize the privilege that this identity gives me. My personal lived experience is different from many of the populations that are referenced in the presentation today. This presentation is really meant to be the start of a discussion, and I know we have time at the end for questions, and I'd really invite you all to share your knowledge on this topic as well, and other examples that you maybe were a part of or are aware of in terms of climate change and health equity. And so by the end of the presentation today, I hope that you'll be able to establish the linkages between climate change and health equity, identify resources, tools, and approaches to help center health equity into climate change activities, and have knowledge and examples of climate change adaptation measures that promote and advance health equity. Next slide, please. And so before we get into the meat of the presentation, let's remind ourselves what we mean when we talk about health inequity. So health inequities, they're avoidable, they're unfair, and they're unjust differences in health. And in many cases, health differences are not random, but are in fact patterned across the population. And they're a result of how societies distribute resources, power, and opportunities, and often a result of lasting colonization, discrimination, and racism. And the statistics on the slide here illustrate this point. And so we can see very different life expectancy and infant mortality rates for Inuit versus non-Indigenous Canadians. Next slide, please. So as you all know, climate change is impacting the health and well-being of people and health systems across the world. And many of these impacts occur by acting through a range of social, environmental, cultural, and economic pathways that influence health. So for example, the impact of climate change on our food systems, and as a result on food security, status, and nutrition. Next slide, please. And so the intersection of climate change and health equity is complex, and it has a number of different dimensions to explore. And we will explore these different dimensions throughout this presentation. It can be difficult to conceptualize the various ways in which climate change intersects with health equity. And so for Canada's most recent National Climate Change and Health Assessment, I developed a framework with my colleagues to help illustrate these relationships. Next slide, please. And so I'll walk through this framework just very briefly. You'll see the drivers of inequity at the top in yellow. So these are upstream drivers. They include things like social and cultural systems and structures. So for example, things like the patriarchy, ableism, cisnormativity, as well as political and economic systems and structures. So things like capitalism and political and educational institutions. along with structural racism and historic and ongoing colonization. So these structures all result in the unequal distribution of money, power, and resources, and this influences the status of an individual's determinants of health. So for example, high versus low income, high quality housing versus low quality housing. And the relative differences in determinants of health give rise to health inequities. And so as we keep moving down the framework, we can see that the determinants of health and health inequities influence climate change vulnerability because of their impact on an individual's exposure or sensitivity to a climate hazard and one's adaptive capacity. And so this, of course, has implications for community and individual health and well-being. The green boxes on the right indicate the linkages between climate change adaptation and health equity. And so adaptation measures themselves can interact and impact determinants of health and influence climate change vulnerability, either in a negative or a positive way. And I'll provide examples of that in a couple of slides. But first, if we could just go to the next slide. I want to take a closer look at the part of the framework that addresses the complex relationship between drivers of inequity, social determinants of health, and climate change vulnerability. So differences in exposure, sensitivity, and adaptive capacity result in some people being more severely affected by climate change. So exposure to a climate hazard may differ across individuals, and this could be based on geography, for example. So communities in Canada's north are experiencing warming at an average rate twice that of the rest of the country. And this places them on the front lines of climate change, so exposure to impacts might be greater. But exposure can also be related to determinants of health. So for example, one's working and living environments. So exposure to extreme heat could be increased for those who do not have access to air conditioning, or for those who work outdoors, for example. Sensitivity to such impacts also creates differences in how people are affected by climate change. So for example, you'll see on the slide here that people with chronic health conditions are more likely to have a serious health problem during a heat wave compared to healthy people. And then an individual's ability to adapt is influenced by a number of different factors as well. So many are directly related to determinants of health. So for example, evidence suggests that communities that have more resources are better able to adapt to climate change. And this isn't just financial resources, but things like access to information and technology and social cohesion. So these can all increase adaptive capacity. Next slide, please. And so just to illustrate this, you may be familiar with the extreme heat event that covered much of Western Canada and the US in the summer of 2021. And so evidence has found that those who lived alone were socially isolated, live in a neighborhood characterized by urban heat island effect, and in socially or materially deprived neighborhoods were all risk factors for heat-related mortality. Heat-related deaths were also higher among persons that are on chronic disease registries. And a study published recently in BC that was looking at the risk of death for people with different chronic conditions found that mental illnesses were among the conditions that left people most susceptible to death, and those with schizophrenia were at the highest risk. And when we're looking at protective factors, evidence suggests that indoor cooling, social connection, living in proximity to green space and tree canopy cover, and social privilege were all identified as reducing risks. Next slide, please. So we may get asked by decision makers and policymakers about who's most at risk to the health impacts of climate change. And this information can be helpful in determining where resources should be targeted, but the answer isn't always straightforward, as we've just seen. So although all individuals display some vulnerability factors to the health impacts of climate change, this vulnerability is not uniform, and there's a lot of different factors and elements that contribute to how one experiences climate change impacts and what influences their ability to adapt and cope to those health risks. So research on populations at highest risk, they commonly identify these broad groups, which include seniors and children, pregnant people, people with chronic medical conditions, individuals with low socioeconomic status, racialized populations, and Indigenous peoples. Next slide, please. However, it's really important to keep in mind that the groups that are commonly identified as most at risk are not homogeneous. There's many differences among and within these groups, including strengths and assets that can contribute to climate resilience. And so as research continues in this field and as the understanding of climate change vulnerability evolves, we see increasingly the importance of taking an intersectional lens to understanding climate change vulnerability. And this includes considering how multiple existing inequities can interact and shape and compound experiences and responses to climate change. Next slide, please. I also just wanted to highlight that in many cases, Indigenous communities are on the front lines of climate change and uniquely sensitive to climate change impacts due in part to their relationship with and their dependence on the environment, and also due to historic and ongoing effects of colonization and an already greater existing burden of health inequities. It's also important to recognize that despite these challenges, Indigenous peoples have been actively observing and adapting to climate change in a diversity of ways, and Indigenous knowledge systems and practices have been really critical for their survival and resilience, and continue to contribute to our understanding of climate-related health risks and effective responses and adaptation measures. Next slide, please. So we know that the health impacts of climate change can be reduced or prevented if we rapidly and substantially scale up efforts to adapt to the growing threat to health. However, adaptation measures are not always experienced in the same way across populations and communities. Next slide, please. So evidence has found that in some cases, when adaptation measures are planned without consideration for health equity, the outcomes of the measure may only benefit parts of the population and may even inadvertently exacerbate existing inequities. So for example, increasing green spaces in an urban center can reduce health risks associated with urban heat islands, and they also have a number of associated health co-benefits. However, not everyone has access to green spaces. A study in Toronto, Canada, for example, found that low-income and racialized communities have less access to tree canopy cover and public green spaces compared to predominantly white communities. And this is a trend that has been observed in many large cities across the globe. So developing new green spaces in communities and neighborhoods that currently lack access to them is one potential intervention to address this. But in some cases, new green spaces have led to gentrification and increased property values in the neighborhood. And this could lead to the displacement of low-income residents and small local businesses, which can actually further widen disparities. So these are the kinds of things that we need to consider before implementing adaptation actions and ensuring that we're designing complementary measures to mitigate potential negative effects. And so in an effort to address the concerns with developing new green spaces, for example, adaptation plans may involve instituting rent control policies and other strategies to maintain housing affordability, really ensuring that the populations that are most in need are prioritized. Next slide, please. So based on what we've talked about so far, it likely comes as no surprise that a key message from this presentation is that health equity should be an important focus of climate change and health activities, such as vulnerability and adaptation assessments and related knowledge development activities. Next slide, please. And this is important because in the absence of consideration for health equity, our climate change activities, both adaptation and mitigation measures, can result in undesirable outcomes, as we've just discussed. But there can also be impacts not only on our populations, but also on the health system. For example, a study in the US found that $230 billion of direct medical costs and $1 trillion of indirect costs associated with illness and premature death could have been saved between 2003 and 2006 if health inequities were redressed. Next slide, please. So there's some tools that can help to integrate health equity into the climate change work of the health sector and public health. I've grouped them into a couple different categories and provided some examples under each. As I mentioned before, Canada's National Climate Change and Health Assessment, there is a chapter in that assessment on health equity that provides more detail on these opportunities. In the interest of time today, I'll just briefly go over some examples, but I encourage you to take a look at that report if you do want to learn more. Also want to note, not all the examples on the slide have been designed specifically for climate change, but they can be applied to climate change activities and our policymaking activities. So you might be familiar with health equity impact assessments and sex and gender-based analysis tools. So these are analytical tools that can be applied to the development of policies, research, and projects that help to assess how that project will impact health equity, either in a negative or a positive way. Resilience and asset mapping can be quite an important tool. These are commonly community-based exercises that can identify people, organizations, spaces, and other intangible factors that contribute to community resilience. So things typically not captured in common sources of data. And this is really taking a strength-based approach and really helping to understand what assets exist in a community. And then policymakers can use that information to inform where vulnerabilities still exist and where protective measures may need to be enhanced or expanded. Similarly, vulnerability mapping provides information on social conditions and climate change vulnerability in a specific region. So typically they're based on an index that uses social vulnerability indicators that are overlaid on a map of biophysical impacts or projected climate change effects. And then community engagement is also a really important one, and I'll get into that in a couple of slides. So if we could go to the next slide, please. So this is just an example. The EPA in the US has an environmental justice screening tool. It's a great example of a mapping tool that brings together data from a number of health important sectors, including environmental, demographic, and socioeconomic indicators. And this tool helps the agency screen for areas that might be candidates for additional consideration, analysis, or outreach as the EPA develops programs, policies, and activities that may affect communities. Next slide, please. So ensuring inclusive, equitable, and community-based participation in the adaptation process is really critical for designing and implementing effective adaptation actions. Next slide, please. So residents and community-based organizations have really important information that can not only help inform our understanding of climate change vulnerability in a specific region or community, but also what effective adaptation looks like. And so in each community, effective adaptation may look different based on the existing assets, vulnerabilities, the social conditions, and also the values and the priorities of the community. So there's not necessarily a one-size-fits-all approach to adaptation. And that's why it's so important to have the community involved and to really broaden the tent of engaged stakeholders and connect with those most at risk to help inform what the response to climate change looks like. Next slide, please. So evidence suggests that adaptation measures, when they are planned with care, they can promote health equity and strengthen determinants of good health, which increases resilience to climate change. Next slide, please. And so there are examples of this work already happening. For example, a recent report prepared for the Inter-American Network of Academies of Science describes in detail how mitigation and adaptation actions can benefit health and advance health equity. I pulled just some examples from this report, but at the national level, we're seeing that nationally determined contributions, which of course are part of the Paris Agreement, they're increasingly taking a health and all policies approach. And in the Americas, relative to other regions, it was found that a number of NCDs reference health and the integration of health aspects into this climate planning and policies across all sectors can really help improve health and health equity, as well as achieving other global ambitions like sustainable development goals. Next slide, please. Also just wanted to highlight some more local efforts. So the Healthy Home in Nunatsiavut is a good example of adaptation actions that simultaneously strengthen determinants of health. This is a local project funded by Indigenous Services Canada. They have a climate change and health adaptation program. And so the aim of this project was to develop climate resilient housing infrastructure that was also culturally relevant, affordable, energy efficient, and reduce the health impacts from overcrowded dwellings and mold. It was a collaborative project that had high community involvement, and important cultural values from the community really helped to inform the design of a prototype climate adapted housing development. And so the design included space to store hunting equipment and large steel sinks for cleaning fish and preparing seal skins, and large open concept living spaces to allow for gathering. And these were all features proposed by the residents and incorporated into this final design. And this project really was addressing a number of important things, including several determinants of health. So safe and healthy housing, support for traditional activities that benefit well-being and build social cohesion. So all really important factors for climate resilience. Next slide, please. This is an example from Fresno, California, where existing nurse home visits were modified to include a heat risk assessment. And so this included a checklist where nurses would assess window conditions and the presence of working air conditioners and barriers to paying utilities. And those nurses could then make energy assistance referrals and health referrals based on their client responses. So for example, they could provide their clients with information on heat illness and protective measures, and also enroll their clients in utility payment assistance and home energy improvement programs. And so just an example that we don't always have to reinvent the wheel, and that in many cases, public health have existing programs that may just need to be adjusted to address climate change and enhance adaptive capacity. Next slide, please. So I think it's just my last two slides. So really quickly, just want to note that, you know, the concept and promotion of health equity is not new for public health, and challenges do remain about the most effective way to integrate this into climate change and health activities. And so wanted to draw your attention to some work done by the National Collaborating Center for Determinants of Health in Canada. And they've identified a range of public health roles for advancing health equity in relation to taking action on climate change. And this may be useful for some of your future activities and planning processes. Next slide, please. So many policies that actually affect our health fall outside of the health sector. And so you may have noticed that some of the examples of adaptation measures that I provided today fall outside the jurisdiction of public health. And so it's important that health considerations inform the development of climate change policies and actions across sectors and industries, such as energy development, transportation, agriculture, urban planning, and public health professionals and other folks in the health sector have a role to play in broader climate change planning and can really offer important contributions and insights to their colleagues' work in other sectors. Next slide, please. So finally, I just wanted to mention the importance of monitoring and evaluating our adaptation measures. So despite our best efforts to consider health equity throughout our adaptation process, there could still be unintended consequences or unforeseen negative impacts that result. Climate change adaptation measures are relatively new still. We're starting to see efforts ramp up, but we don't have a lot of research that's monitored the impacts of adaptation measures over the long term, and have very little understanding of how the outcomes of adaptation measures will impact health equity. So evaluating climate change activities for impacts on health equity is really important. This will, help to ensure that actions don't inadvertently exacerbate inequities or negatively impact parts of the population. And it can also provide information on if the measure is actually working and doing what it was designed to do and protecting who it was designed to protect. We're increasingly seeing evaluation frameworks and indicators for adaptation processes and success. On the slide here is just one example of a monitoring and evaluation framework. It assesses the effectiveness of an adaptation measure by evaluating its effect on 7 domains that are related to determinants of health. So things like infrastructure, social, economic, community, and environmental factors. It also provides indicators and guiding questions to help the user in understanding the positive and the negative implications of their adaptation measures. And really, this should be an ongoing and iterative process. So as time goes on, you might notice that there are parts of a measure that need to be tweaked or reworked to make sure that we're really maximizing the benefits and minimizing any negative impacts. Next slide, please. So I'll leave it here today. My contact information is on the slide, and really looking forward to the discussion, and happy to take any questions that you might have.
Program. So I would firstly like to acknowledge that I am joining you all from the city of Mississauga, which is part of the treaty lands and traditional territory of the Mississaugas of the Credit First Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and Wyandot nations. The city of Mississauga is home to many diverse Indigenous peoples, and I'm very grateful to live, work, and learn on these lands. I would also like to acknowledge my positionality as a cisgender second-generation Canadian of South Asian descent. I bring my own perspective and lived experiences to the discussion and recognize that my background and privileges shape my understanding of health equity, as well as the work that I do. So we can move on to the next slide. So to begin, as you all are aware and have heard from earlier presentations, Canada's climate is warming rapidly, and climate change is affecting the health of Canadians across the country, as well as the health systems that they rely upon. As you know, Canada's climate is warming at twice the rate of the global average and up to 3 times this rate in Canada's north. Next slide. So climate drivers of health that need to be understood in order to adapt are mediated by a range of determinants of health and other situational, behavioral, and organizational factors. And as you heard in Rebecca's presentation, the pathways through which climate change impacts health and health systems is complex. And there is increasing recognition of the impacts that climate change can have on health systems and the important mediating effects of building health system capacity, proactive adaptation, and GHG mitigation measures on health outcomes. Next slide. So the figure on this slide does a great job at summarizing some of these additional risks of climate change to health in Canada, including direct and indirect impacts. So you'll see in the middle a list of vulnerability factors with the risks of climate change to health in Canada, including mental health impacts as well. And on the right, I'll note reference to Health Canada's National Climate Change and Health Assessment, which provides a scientific assessment of how climate change really affects human health and the health system in Canada, and really speaks in further detail to all of the slides. Next slide, please. So recognizing this information really poses the question of how we can work to ensure that all people are resilient and protected against the health impacts of climate change. And this is where our Health Adapt program comes in. Next slide, please. So Health Adapt is a multi-year capacity building program managed by Health Canada, which supports the Canadian health sector in preparing for and responding to the impacts of climate change. Its program approach is based on the successful US CDC model, Building Resilience Against Climate Effects Framework, which is used for climate adaptation planning. The program provided approximately $3.5 million in funding to 10 health authorities from 2019 to 2022 to support their climate change and health efforts at local, regional, provincial, and territorial levels of the Canadian health sector. The objectives of the Health Adapt program were to increase the understanding of climate change impacts on health systems along with the health of Canadians, to identify communities or people who could be more at risk of experiencing negative health effects of climate change, to support the development, testing, and carrying out of local and regional climate change and health vulnerability and adaptation plans with partners, and to monitor and evaluate the effectiveness of these plans. Next slide, please. So each of the Health Adapt projects really focused on conducting local and regional level climate change and health assessments, which were specific to the needs of their communities. So the program really went beyond a one-size-fits-all approach, and each project had unique outputs and products as outlined on this slide. And the Health Adapt projects really represent the diversity across the nation, as the 10 funding recipients represent different geographical regions, such as coastal, northern, and remote communities that have distinct drivers of climate risks and vulnerabilities. The projects also integrated and engaged with different populations, such as Indigenous peoples, seniors, people with pre-existing physical and mental health conditions, people with lower socioeconomic status, and racialized populations. And here I'll note again, these are just examples of some of the project outputs from each of our funding recipients. In the slides, you'll note that there are hyperlinks at the bottom, and also at the end, I'll make mention of our Health Adapt website. We do have all of these linked on our website, along with digital case story videos, actually, that were developed to highlight the project work of each of our funding recipients. So you'll really be able to get more information there on the type of work that they did, the populations that they focused on, the different type of outputs that they developed and outcomes of their assessments, as well as next steps. Next slide, please. And I would like to highlight here, and I know this was flagged by Rebecca as well, that First Nations, Inuit, and Métis people have been actively observing and adapting to changing environments in a variety of ways since time immemorial. And preparing for the health impacts of climate change really requires that Indigenous peoples' rights and responsibilities over their lands, natural resources, and ways of life are respected, protected, and advanced through distinctions-based Indigenous-led climate change adaptation policy and research. And here I'll mention that one of our 10 funding recipients of the Health Adapt program was the First Nations Health Authority in British Columbia. And I was looking through the list of attendees, and I think we're fortunate to be joined by some of our funding recipients on the call today. But here I'll mention for the First Nations Health Authority, their project really assessed climate change impacts on Indigenous marine food safety and the vulnerability of BC's coastal First Nations to develop local and Indigenous specific adaptation strategies. And their work really focused on adopting traditional food harvesting techniques and seafood storage mechanisms by working with First Nations community members at all stages of the project and enabling community ownership of data by working with pilot communities on data agreement requirements. And I'd also like to mention the Northwest Territories Department of Health and Social Services, who were another one of our program funding recipients, who led a project to undertake a comprehensive assessment of the health risks posed by climate change in the Northwest Territories, and to develop and implement a Health and Social Services Department action plan. And their project included meaningful engagement from all 33 communities in the Northwest Territories, including Indigenous peoples. Next slide, please. So I'd like to note that health equity and the social determinants of health were components of our Health Adapt program and projects. So the program integrated an awareness and understanding that climate change is an amplifier of social inequities and vulnerabilities, and gave particular consideration in the call for proposal stage to projects that integrated sex and gender-based analysis and also focused on populations disproportionately affected by climate change. And the application of health equity varied amongst projects, given the differing and distinct demographics and vulnerabilities of each health region. And funding recipients aimed to prioritize, integrate, and engage with the needs of populations within their respective health regions throughout their project work. And on the right, you will see examples of guidance documents, technical support, and a 6-step framework that was developed by Health Canada to support partners in conducting their assessments. And both the documents and the framework underline the importance of meaningful integration of health equity in all stages of their project work. And as highlighted there in the last bullet, health equity considerations can be used in identifying pilot communities, in data collection, and in informing adaptation actions. Next slide, please. So here are just a few examples of additional factors that influence vulnerability and adaptive capacity, along with populations at greater risk to the impacts of climate change. And we've touched on these previously as well, so we can just continue on to the next slide. So as part of the Health Adapt program evaluation, lessons learned research was conducted to inform future programming and also provide an overview of various challenges, opportunities, and lessons learned from funding recipients, but also from health authorities and experts in the field of climate change and health. And currently, a lessons learned report is being drafted, which provides practical steps on how to get started on addressing these climate-driven health risks. So here you'll see highlighted some of our findings. The image on the left highlights top challenges and opportunities that were identified in the first iteration of the program. So top challenges included things like access to data and competing public health emergencies, while top priorities in opportunities, included access to networks and really conducting the significance of conducting community-based participatory research and having that engagement to ensure that health equity considerations inform adaptation planning and decision-making. And on the right, we have also included key takeaways from funding recipients on their experiences in conducting climate change and health work. So here you'll see, the importance of having clear objectives in VNA work and climate and health work, and the importance of meaningful engagement through all stages of project work. They also highlighted the importance of integrating lessons learned from the COVID-19 response, as well as increasing more focus on prevention and preparation for extreme weather events. They also recognized and highlighted the need to really see adaptation as an iterative approach. And lastly, the importance of having adequate staff capacity to really work on VNAs and climate and health work and really progressing it to the next stages towards adaptation. So the Health Adapt program has contributed towards building capacity amongst health authorities in Canada through providing protected funding, building the labor force, supporting decision-maker buy-in, allowing for greater interdepartmental collaboration, increasing partner engagement, and promoting knowledge mobilization. Data that has been generated from Health Adapt projects really provides important new information on climate change vulnerabilities, as well as adaptive capacity through health regions across Canada. They serve as a foundation of adaptation for health authorities across Canada and internationally, and results will help to inform adaptation planning, ensuring greater resilience to and better preparation for future climate change events and impacts. Next slide, please. Here, I would also like to highlight Canada's National Adaptation Strategy, which has kind of been finalized and released within this past year. So this strategy really presents the first comprehensive framework that was established in the country on climate adaptation to provide an overarching vision for building climate resilient communities in Canada. So the strategy includes 5 key systems, including health and well-being, which was one of the tables that was led by Health Canada. And the strategy really follows 4 guiding principles that are rooted in fair, inclusive, and equitable adaptation that empowers communities, regions, and First Nations to develop plans that are tailored to their needs while moving all of society towards a safe and resilient future. Next slide, please. I'd also like to highlight the Government of Canada Adaptation Action Plan, which is released alongside the strategy. which announced that Health Canada will invest up to $43 million over the next 5 years to fund programs that will support the health sector and people in Canada to adapt to a changing climate. So really exciting news here. So that funding includes the renewal and expansion on work of our Health Adapt program, and also efforts to protect the health of people in Canada from extreme heat. And with this new funding, Health Canada will aim to, really measure progress towards low carbon and climate resilient health systems, continue to fund health authorities to assess and address climate risks, and demonstrate federal leadership and mobilize action with partners through knowledge sharing. Next slide, please. So I'd like to thank you all for listening to the presentation. If you would like any additional information on the Health Adapt program or to learn more, please feel free to visit our website or email us. We do also have an online community of practice, so we'd love to add you to that and really share any additional information on our program and future opportunities as they become available. So thanks again, everyone, and happy to take any questions.
Hello, everyone. It's wonderful to be with you here today. My name is Cecilia Sorensen, and I'm going to be speaking about training opportunities for the health sector workforce to tackle the climate change challenge. And so we all, I think, recognize the importance of education and training in building the capacity of the health sector to tackle the health impacts related to climate change. From the IPCC report, Our Best Science tells us that the severity of climate-related health risks is highly dependent on how well health systems can protect people. So with timely, proactive, and effective adaptation, many risks for human health and well-being can be reduced and some potentially avoided. However, in order to realize this, we need a health professional workforce that is trained to prevent and respond to climate-related health impacts. According to data from the WHO Climate and Health Country Survey in 2021, 55% of countries flagged insufficient human resource capacity as a main barrier to implementation of national climate plans. And additionally, 46% reported insufficient access to tools, methods, and technologies. So despite the fact that we know training and capacity building of the health sector is essential, we are lacking on a global level at a national scale the human resource capacity and the tools to be able to realize the potential health gains resulting from adaptation. And these capacity gaps exist on the national level, but also on local levels. So in a recent survey of local health departments in the United States, the two top areas identified in terms of training needs were all hazards planning and disaster mental health resilience, both of which are closely related to climate change. Further, it was found that 65% of local health departments currently have no activities related to climate change adaptation, and only 8% are investing in training in this area. So we have capacity gaps across the board, and some of this may stem from what is happening in our academic institutions globally. And so in the United States, we know that among schools of public health, very few schools are actually requiring students to be trained in the health impacts of climate change, and very few schools are offering specialization in climate and health among master's level public health degree programs. Reports are similar on the global level. So among schools which train physicians, currently only about 15%, this was in a recent survey of over 3,000 schools, are reported to have incorporated climate and health into the curriculum, and 40% of surveyed medical graduates believed that their education on environmental health was inadequate. So there's many gaps that are preventing academic institutions from really training health professionals in climate and health. Some of them are listed here. This is from a recent survey of Global Consortium on Climate and Health Education members. Challenges are including a lack of teaching materials and staff expertise, a lack of time, a lack of funding and support, and many other competing priorities. All this to say that there are large training needs that need to be addressed in order to protect populations in the Americas from the health impacts of climate and environmental change. So where should we focus education and training, and where is it needed? I would say that no one health specialty can take full responsibility for bringing health departments and the health sector up to speed in terms of climate and health adaptation. Really, an interdisciplinary response is needed throughout sectors with strong political as well as institutional support. And we need adaptation of our health systems in terms of primary, secondary, as well as tertiary prevention. And note here that if we invest in primary prevention, there is an increasing population impact and also a greater return on investment in terms of healthcare savings. So what does training look like for primary prevention? Well, for public health professionals, we really need that specialty to build the evidence base to understand interactions between climate change and population health. And this requires technical capacity for analyzing, managing, and sharing climate and meteorologic data. Just one example. Clinical health professionals are needed to build the evidence base to understand interactions between climate change and clinical practice. And what this requires is close coordination with public health and an understanding of the science so that they can translate public health studies into meaningful action plans at the individual and clinical level. We also need an entire health sector approach to perform vulnerability assessments of climate and health risks to population health and healthcare systems, and to establish community-based practices to prevent health harms. This requires technical capacity to perform vulnerability and adaptation assessments, really good skills around community engagement and buy-in, as well as excellent communication and especially risk communication. And so this is really a whole of health sector activity, but that is rooted in some technical capacities which need to be developed. Just as an example of where we are in the Americas in terms of conducting national level vulnerability and adaptation assessments. Many countries do have these completed, others have them underway. This is really a first step in addressing health risks. And we notice that progress is being made on the national level, but not necessarily on state or provincial levels. Here we're looking at countries which have national health and climate change plans or strategies, which is often a step that comes after the development of a comprehensive vulnerability and adaptation assessment. Note that since the publication of this figure, Canada did release its national adaptation strategy, which has human health as a key pillar. Again, these are national strategies, and currently there is data lacking in terms of the state of provincial and local adaptation planning and assessments. So when it comes to secondary prevention, we need public health professionals to be able to build and test surveillance systems for climate-sensitive diseases and exposures, for example, extreme heat and vector-borne disease. This requires technical capacity for collecting, analyzing, and managing health data and integrating it with climate models. These are skills that currently are not being not necessarily being taught in public health schools. So these are secondary skills which public health professionals need to gain. Our clinical health professionals, we need them to be able to create, update, and adapt health guidance and treatment plans for patients. What this requires is evidence-based research to understand viable clinical approaches to prevent and manage individual health concerns. And so lots of training and capacity building is needed in terms of secondary prevention. We also need an entire health sector response to come together to develop evidence-based strategies to reduce health inequities and disparities arising from climate-related exposures. We know that climate change affects everyone, but it doesn't affect everyone equally. And those who are marginalized are suffering worst, and they're suffering first in terms of health impacts. And this is really going to require an entire health sector approach in order to prevent this from continuing in terms of trends in the future. And a lot of capacity building is needed in order to get to the place where we want to be. So there is a growing amount of guidance and information available to health authorities, yet we know that despite this guidance, that many gaps remain. And so if we want to see the transformative changes that are truly needed to address climate risks to health systems, what we need to do is build capacity for our health professionals to be able to take these types of assessments and apply them to their everyday work. When it comes to tertiary prevention, We need our public health professionals to be able to mobilize partnerships to identify and solve health problems, and also to investigate health problems and hazards. And this requires a robust technical capacity for collecting, analyzing, and managing health data in real time. And our clinical health professionals must participate in, disaster management and are really charged with protecting and caring for vulnerable and affected individuals. And this requires additional training beyond what is currently being done in many health professional training institutions and in continuing professional education practice. In terms of tertiary prevention, the entire health sector really needs to increase its capacity to be able to use best practices to coordinate interdisciplinary responses to compound disasters and other acute events related to climate change exposures. So at the Global Consortium of Climate and Health Education, our mission is to ensure that 100% of health professionals globally have the knowledge and skills to recognize, respond to, and prevent climate-related health impacts. And so our work is around organizing, empowering, and amplifying the voice of health professionals to convey how climate change is harming our health and how climate solutions will improve it. And so here is a map of our current membership. We have nearly 300 schools of medicine, pharmacy, nursing, public health from 60 different countries who have pledged at the level of dean or head of school to train their students in climate and health. Additionally, we have many incredible NGO, government, and health association partners who we work with on program development and implementation. So we seek to engage and strive to organize efforts to build capacity and opportunities on many different levels among students, faculty, and practicing health professionals, among health professional training institutions, within national and regional health associations and societies, and among governmental and intergovernmental agencies. And so we really use a multi-pronged approach in order to allow education and training to reach the different areas where we know it is needed. So, for example, we support institutions and faculty who train students. We support existing health professionals through continuing education opportunities. We provide technical support and partnerships to health professional societies and associations. We work to promote transdisciplinary climate and health research. We partner with governmental and non-governmental organizations to provide technical support and consultation. And we also work directly with students and among student-led initiatives. One of our core functions is that we produce and iterate core competencies for all health professionals as it relates to their roles and responsibilities in addressing the climate crisis. And so these competencies are created by an interdisciplinary team of experts, and then are peer reviewed by all of our consortium members. And broadly, they cover climate and health knowledge and analytic skills, climate change and public health and clinical practice, policy aspects of climate change and health, as well as communication. And in practice, these competencies can be applied in many ways, both to guide curricular development, as well as to guide course development and toolkit development, and so on and so forth. And so in order to reach the audiences that we know need training and capacity building in climate and health, we offer a broad suite of courses in collaboration with many of our incredible partners, including the Pan American Health Organization, Health Canada, NOAA, the IAI, CIMH, and more. So just to give you an example of some of our recent activities, last spring, or the spring of 2022, we developed and launched 3 regional courses through which we worked with expert speakers from each of these regions, worked with our partners to develop courses that were geographically and culturally relevant and that were taught in multiple languages. And so in the spring of 2022, we opened these courses for free in a certificate-based fashion to these regions and had over 5,000 health professionals register for and received certificates in climate and health, which is really exciting. And I think this shows just how much demand there is from practicing health professionals to increase their competence, increase their confidence in climate and health. And we saw professionals coming from both the public and the private sectors, from NGOs, from academic organizations, from government organizations, and so on and so forth. So when we set out to do these courses, the course objectives really depend on the audience, and we sort of function in a tiered approach. We have different levels of courses, where the most primary level is a level 1 course where we are training health professionals in foundational climate and health knowledge Our level 2 courses seek to develop an increased competence, a deeper learning and appreciation of the content. And our level 3 courses are really geared towards experts who want to be deeply involved in action and engagement. With all of our courses, we do longitudinal surveys in order to understand the success and where our courses can be improved. So we recently published findings from our course, which we ran in spring 2022 in the Caribbean. We had participants from over 50 countries with many backgrounds, including nursing, public health, environmental health practitioners, emergency responders, physicians, social workers, mental health care workers, and more. And so after this 8-week course, we found that respondents reportedly increased how often they were communicating with patients and community members and colleagues about climate change and health. They were reporting that they were increasing how often they incorporated climate and health knowledge and skills into their professional practice. And we saw an increase in participants' confidence in their abilities to lead climate and health initiatives in their communities, institutions, or places of practice. And so this is all really exciting, and I think shows just how ready health professionals are to start taking on this type of information. And our work continues to grow. So just this last spring, the spring of 2023, we worked with many partners here today to offer the Pan American Health Sector Resilience course, which was, I would say, a level 2 course. And it covered the whole geographic area of the Americas and was delivered by expert faculty from throughout the region. And this was really intended to reach health care decision makers, as well as practitioners and many others who are deeply concerned and involved in climate change and health adaptation. We also offer more targeted and workshop-based courses. So for example, this course, which runs every 6 months, is the Life Cycle Assessment for the Health Sector course. And what it does is it equips health professionals to undertake life cycle assessments for common products and processes involved in the delivery of healthcare. We work closely with teams of health professionals from around the world, and they actually complete a life cycle assessment during this workshop. So it's a smaller type of course, but at the end, we really see that we've generated a ton of expertise among course participants. We also partner with large health professional societies to provide technical expertise to build trainings geared towards their audiences. So for example, we work with the American College of Healthcare Executives to run boot camps, workshops, virtual trainings, specifically geared towards healthcare executives. And so this was a course that we ran just this past August in New York City. We've also had the privilege to work with ministries of health. So for example, the Ministry of Health of the Bahamas received Green Climate Fund funding in order to build capacity among their health sector. And part of the activities, we're putting on a 2-day workshop to train healthcare professionals alongside community members in a partnership in order to build community level resilience. And so with this incredible in-person setting, we were able to see really transformative collaborations and learning take place. And this work became the basis of climate and health adaptation for the region, and results from these workshops fed into a training plan for the Ministry of Health to really continue this work. And so these types of engagements really do work. You know, we really aim to study so we can develop an evidence-based approach to training and capacity building. So for example, following this workshop in the Bahamas, we observed statistically significant improvements in hazard recognition for climate change related exposures, for example, due to degraded air quality, droughts, and more. The post-workshop survey also showed improvement in awareness among participants to recognize health impacts of climate change, including respiratory diseases, mental health conditions, pregnancy outcomes, heart disease, injuries and violence, and more. And last but not least, this workshop proved to be highly motivating to participants and appears to have equipped them with solutions to address health impacts of climate change in their communities. And so what we're seeing here is a shift in the reported readiness of participants to work on addressing the health impacts of climate change. We also are wrapping up right now a course which we put together with the Andean Health Organization. We partnered with them in order to train ministries of health and environment in climate and health, the fundamentals, as well as evidence-based strategies to increase resilience and adaptation. And right now underway, we have a course on El Nino in the Americas, protecting health and promoting resilience. And this was developed by an incredible working group with members from the World Health Organization, the Pan American Health Organization, the IAI, and the UNDRR. And so you are welcome to join this course. I can put a link in at the end of this so you can register for it. So in addition to running courses on regional as well as global levels, the Global Consortium on Climate and Health Education also supports a vibrant learning collaborative. So we know that evidence is emerging every day in terms of best practices regarding adaptation. And what this learning collaborative does is it brings experts together to discuss emerging findings and to collaborate and share information, which is just so important during this crisis. We also work with institutions such as UNICEF in terms of providing technical expertise, the development of adaptation resources. At the Global Consortium on Climate and Health Education, we have incredible experts in climate and health from the backgrounds of medicine, nursing, public health, social work, and so on and so forth. And so we aim to leverage our capacity in order to help inform these types of guidance documents. And we always have a lot under development. So we are currently building a workshop style course that will train participants in how to do vulnerability and adaptation assessments. This is going to be really geared towards provincial and local health departments. We're also working on a course with the Inter-American Development Bank to train health economists in climate and health. We're developing a course in Europe right now with the Association of Schools of Programs of Public Health in the European region, and working with the Lancet Countdown to develop indicators to really judge our progress in this space. On our website, you can find many resources available. All of our courses are recorded, they're posted online, they're free to access. We also have many slide decks that can be downloaded. The real purpose of our existence is to propel climate and health education and capacity building globally. So we invite you to use these resources however they might be useful to you. And if you have any questions or if I can provide any more information, my email address is here, so please feel free to contact me. I hope you have a wonderful day. Thank you so much to the organizers of this conference. What a tremendous opportunity for us to come together around this incredibly important issue. Thank you and have a great day.